guys and if, we all try to be tough and all that. It's just don't be that guy that's going to say, you know what, I'll do it next year. I'll do it next year. I'll do it next year. When the time's right, do it, get your screening because it could save your life. And basically, that's what we're talking about today.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
What I'd like to start, because Alonzo talked about the screenings that athletes get every year for your preseason physical, pre-participation physical. Most men don't get that level of care that they get someone to look at them every year. Did any of the years that you guys played, and I'll start off with you, Glenn, when they took a look at you, did any of that help you with adopting a lifestyle where you continued after retirement getting screenings?
I think it did. I think at an early age, first and foremost, the awareness, it made you pay attention to your health. When we're young, we think we can go forever. We think we're going to be healthy forever, and nothing can stop us. But I think with the information that we gathered through the screenings, through the different doctors, it made us realize that we're not invincible, and we have to pay attention to our body, our mind, because that's going to help us in the long run, physically and mentally. If you're as strong as possible, healthy as possible, it's going to give you a much better chance of being successful on the court. So definitely, it made a difference.
Ed, what do you think?
Well, I just echo what Glenn was saying. I think as a player coming into camp, you're more worried about your physical test scores than the screenings that you're getting. Because you said, like, at a young age, you're really not really thinking of that. Now, as we get older, if you're going to break it into, first 10 years, next 10 years of my career, absolutely. I was really wanting to know my results, what my scores were. And especially now, I'm right to the second I'm in the doctor's office when my physical is due, because we're getting older, we're starting to worry about these things and want to make sure that we stay on top of it. And I think now is really important, especially with the knowledge and all the information that's out there. It's right at us, and the doctors and the cares. I think it's really important.
Yeah, I mean, to me, it's right. We talked about awareness. Like, it's the awareness. When we're younger, you're growing up, you feel strong, you don't think anything's going to happen to you, none of that stuff. And you get these screenings and you just don't know it because you're an athlete and they're just doing it for you. And as time goes on, you realize that age is catching up with you, and you have to do these things that are necessary for your health. And I'm the same as Eddie. Like, I'm the first one in for my physical. And fortunately, my wife, schedules all that stuff for me, so I'm in good shape that way. Like, she said, this is when you're going, this is when you're going, so I got it. And then obviously doing the work with the team, I always have you guys around to check on all of us. But the most important thing is just, I think sometimes, guys and if, we all try to be tough and all that. It's just don't be that guy that's going to say, you know what, I'll do it next year. I'll do it next year. I'll do it next year. When the time's right, do it, get your screening because it could save your life. And basically, that's what we're talking about today.
All right, I got another quick question.
I thought that was a really good answer there, Doc.
What the? Very good answer.
Okay, yeah. So,
applause.
If I give a good answer, I want that was a good answer.
I've had patients who said, their birthday is the day they get their physical. Because that way they take the day off, they go to the doctor, they go to the dentist, they go to the eye doctor. But whatever day works for you, just make sure you schedule it, because some of these doctors have a long wait time. So, question for you guys. At what age do you get a colonoscopy now? What's the first age?
Yeah, my story is a great story because, again, it goes back to what I mentioned earlier, awareness. And I think all the information was put in front of me. But one of the things I have to say that I was blessed and lucky. I didn't go until my first time was last year. And I think as a man, one of the things that kept me from going, I was probably afraid to hear that the bad news, maybe, perhaps. And so the message that I wanted to tell people today is that, look, you know what? Don't be afraid to go in there. Go in there. I think, your health is super important. Don't do like I did. I got lucky. I went when I'm 57 now. I went last year, I was 56, and I should have done that when I was like 42, 45 in that area. But fear kept me from it because I was afraid to hear the bad news. And fortunately for me, it was good news. So make sure you go in when you have to have your checkups. You got to be on that. You got to be ahead of that, I would say, because then that way you won't fall behind.
Well, thanks for sharing that, Glenn. So he did get the right answer, 45. So for those in the audience, if you're wondering what's the recommended screening age for colonoscopy, 45 years old for men and women.
What if your PSA is at a level where you're not? Because my PSA was low, so I haven't had a colonoscopy yet. I'm 48. So I was told by my doctor that you're not ready for. Is he lying to me?
No.
You're asking for a second opinion on stage? Well, as far as the PSA, Dr. Ozambela, you want to answer that?
Sure. So I'm a urologist. So the PSA and the colonoscopy are separate entities. So think of them completely separately. So PSA screening. Okay. All right. So I guess that one wasn't working. So I was saying I'm a urologist. So the PSA and the colonoscopy are completely separate issues and they're not tied together at all. So PSA screening and colonoscopies, think of them separately. So the right age is 45 for colonoscopy. And if you have family history of any family history, brother, uncle, father or mother who had colon cancer, that's a reason to get screening earlier and more frequently. Okay, so for colon, but PSA is completely separate.
Same hole though, right? Dan, what do you got?
Yeah, well, so I think I was right around 48 or 40, just like Eddie is that age when I got my first one, and I've had 3 so far, and I had a few polyps, little stuff that didn't make a difference. And I have them scheduled for within the year, the span now, to do another one. The worst part is drinking all the stuff the night before, which is tough just to get all that down. But you need to do it because it's important for your lives, your family lives. I mean, everybody that's involved with you, on a daily basis. You need to take care of your health for them. Sometimes you got to stay strong for the people around you and make sure you're strong for the people around you.
And let me just add one more thing. Again, the full disclosure, I'm not a gastroenterologist. I don't do colonoscopies, but there's the recommendation for asymptomatic, don't have any issues, 45. But if you're younger than 45 and you're having symptoms, then you might need to get one sooner. Okay, so right now, we talked a lot about healthy lifestyles, a lot of our nutrition. We're actually seeing younger and younger people developing colon cancers and rectal cancers. And so, if you're having blood when you go to the bathroom, that's not normal. See your doctor. You might be in your 30s and you might need a colonoscopy.
Dan, do you know that, Dan?
I'm sorry, I wasn't listening. We were in a private conversation over here.
Do you want anything you guys want to share or no?
Sorry, no. What's up?
You know that people pay for that cleanse?
For the cleanse of the
like the pre-colonoscopy.
Oh, for the night before? They do.
People pay to do it all the time.
Well, God bless them. I mean, that's probably the worst money they ever spent.
Dr. Friedman, from a cardiology standpoint, where would you say we are in terms of cardiovascular screening?
Yeah, I think we've come a long way. Thank you for not involving me in the colonoscopy discussion. I appreciate that. I think it's about trying to be as proactive and as preventative as possible. It's interesting hearing our former athletes here talk about it. You and I have seen it. When the guys get older in their careers, they actually want to spend more time with us as opposed to running away from us. So it's a really interesting dichotomy. But I think knowing your numbers, right? What's your blood pressure? What's your blood sugar? How's your cholesterol doing? Do you have any family history? And being preventative and proactive in that respect is really good. Like these guys will tell you, if they don't have a game plan when they get on the court or on the field, then it's all over. Forget about it. So you want to have that game plan and be ready to rock and roll. And, you know, hearing what they're talking about, it's also really interesting. It's incumbent upon people like us to be accessible, to listen, to spend time. You would think that professional athletes get the best care, but I'm sure these guys have horror stories where they waited 2 hours, it was a 3-minute appointment, and then that was it. But, you know, we really want to be on time. We want to listen. We want to hear what's concerning to people and really be accessible all the time to make sure that we're able to address every concern that's there.
Let me ask the audience, if you could show your hands, how many of you know how to do CPR? All right, that's excellent, because you want to tell them about the station here?
Yeah, so thank you for the ability to talk about that. Everyone's having fun. They're playing golf, getting their beards trimmed. Please take 5 minutes. Go see members of our team over there. We've got AEDs. We've got CPR dummies. Learn how to do CPR. You're more likely to do CPR in your own home than you are anywhere else. So you're more likely to save the life of a loved one. We've all seen Damar Hamlin and Bronny James and all of those things, but you never hear the stories of when it happens at home. And hey, I wish I would have known how to do this. So please take 5 minutes. Go see our team over there. They're waving their hands. They're clapping, and go over there, learn CPR after all of this. Bernie was doing CPR. My son did CPR earlier. So please learn how to do it. It's a life-saving skill.
So in my daily job, I deal a lot with orthopedic injuries, and I'm sure you guys have seen your fair share. What advice do you have to men to maintain their bodies physically? Ed, you want to start with that one?
Probably the wrong guy to ask.
Go ahead.
No, I think, you know, you look at the importance of obviously getting in the gym, see where that has come in players now, before, after, during, how much time they're spending in the gym, the soft tissue work, you know, the stretching, the yoga, you see, to keep the, you know, muscles toned and all that. You know, diet, you know, everything kind of plays into the game. But I always think that, you know, your body's, you know, I think bring it to the attention of something. You have something nagging. There's probably something going on in there. I had some things going on in my career that I kind of left, and yeah, you're good. You keep going, and then eventually ended up kind of to the extreme point of kind of surgically fixing everything. But yeah, overall, just stay on top of everything. Take care of your body. I think that's the main point.
Dan, you want to go next?
Yeah, orthopedically, I over the years have had a lot of surgeries, and it takes its toll on your body. So as you get older, you need to realize, okay, I need to figure out a way to make my, you know, I had 2 knee replacements, my ankle, just figure out a way to make them strong enough so you feel good about just doing regular everyday things. And I got to a point where I couldn't do regular everyday things, probably 5 or 6 years ago. And then 3 years ago, I got both knees replaced because I was swelling, all that thing. I had to get my knee drained like every 3 or 4 weeks. And it was a time. And you just got to realize, you got to know, you got to be self-aware, I guess, self-aware with how your body feels, what you need to do. But mostly it's, you know, keeping the muscles around your knees, your ankles, your muscles up your shoulders, keeping them strong enough so you feel good each and every day. And if you're not, go see your doctor. Make sure and that's what I did, because I mean, I had a real problem there for a couple years.
Glenn?
Amen. I'm a little old school. I think at the time that we were playing basketball, when I was with the Miami Heat earlier on in my career, as men, we were kind of like pushed out there to play through the pain. And I think a lot of times we probably shouldn't have done that. I think in the long run, it probably hurt us a little bit more than it did at that particular time. But we were headstrong. You know, we said, no, you know what, coach, wrap it up or shoot me up, and I'm getting back out there so I can, you know, continue to keep doing what I do and help the team. I think, however, I feel that now. I find myself now, you know, like I said earlier, I'm 57 now, and one of the things I have to really push myself to do is to stay active and to do my stretching and pay attention to what I eat. And, you know, sometimes when I want that bag of chips, I got to slap myself on the wrist. It's a hard fight, but I realized then that health was a major part of prolonging my career. But now it's just as important now because I want to prolong my life. And so the little things where we say, oh, you know, I got a little backache, I'm not going to worry about it. Well, no, one of the things I do now is pay very close attention to that. And I you know, those signals, sometimes it may seem like it's small, but in actuality, it could be a lot bigger than what it is. And so I encourage everybody when you're, especially at an older age, any age really, but at an older age, when you have those moments and you want to just pass it off as, you know, I'm just getting old, don't do that because the next time it may be something that you can't do anything about it and you just got to wait on your time.
So listen to your body and seek advice. I like
absolutely.
it. I like it. Dr. Friedman, what would you recommend as far as exercise? They all said, you know, exercise. What does that mean to you?
Yeah, I totally agree with Glenn. Actually, it's a nice comment that you have to move, and the adage people think is that in order to move, you got to feel good. But actually, to feel good, you got to get moving. And with age and with time, our bodies will decay, and they won't work as well if we don't use them and engage them. And so I think we make the bar like really high for exercise. You don't have to be a Hall of Fame football player, captain on an ice hockey team, or a lethal 3-point shot to exercise. Like you just have to move. And if you want to go for a 20-minute walk with your kids, if you want to dance, if you want to get in the pool and just jump around for a little bit, all of those things are exercise. Now we have these guidelines that we can hit like 150 minutes of moderate intensity exercise per week, 75 minutes of high intensity. That's great. And hopefully everyone's doing that. But simply moving, doing something with purpose will be the best bang for the buck. We shouldn't make it go do CrossFit or run a marathon. That's great if you want to do it. But just the act of moving is really, really good at the end of the day.
What about running to the fridge in between commercials on the game days?
We call that high intensity interval training. So that's fantastic. Hopefully it's to grab just a nice cold water and nothing more fancy than that. I see Rob Henry shaking his head, so it's probably something else. But, you know, yeah, that'll count. But do that about 50 times and then we're good.
Dr. Ozambela, what's some of the best excuses you've heard for guys not to come see you?
Yeah, so and Alonzo Mourning brought this up earlier, but you know, people are afraid of getting a finger in their butt. But that's not necessarily what's going to happen when you go see a urologist. And you know, a lot of the screening that we do, it's a blood test, it's an imaging study. And the other thing I want to touch on what Glenn said that was really important is, you know, sometimes guys will show up and they'll say, well, I'm having these symptoms, I'm having these issues. It's just because I'm older and it's normal. Well, not necessarily. You know, yeah, things change as you get older, but, you know, and, you know, we have a cardiologist here with us, but, you know, sexual function can be related to heart disease, right? So diabetes, cardiovascular disease can actually show up as difficulty having erections. And so sometimes the first person that a man will see is a urologist because they think, oh, something's going on with my erections, and it's because they have undiagnosed diabetes that's poorly controlled, or they have, you know, cardiovascular disease that's not well managed. So don't blame things on I'm getting older, this is what happens. If you're having changes, you might, you know, want to get checked out.
Dr. Friedman, what about you? You have any top 1, 2 excuses you hear from patients?
The best one is people think when they come see a cardiologist that they're signing up for open heart surgery right away. So we sort of have to convince them that that's not the case. I think Glenn's point's really good. I think it's fear. I think it's really the concern that we're going to find something that we can't do anything about. I'm fortunate as a cardiologist. Most things I can fix and we can get to work on. So I do think it's fear and also just the stigmatism around it, right? 2-hour wait times, 5-minute appointments. Those are the big things that I think keep people away from us.
So let me ask the three of you, yeah, 'cause you guys probably have a little bit better connection with healthcare than most, but what would you recommend for us to reduce the stigma or provide better access to patients? Anything come to mind?
So access, you're talking about to get them to come into the office and
Come
see
to
you
the
guys.
office,
Yeah.
make an appointment. Just
Yep. So to me, it's going back to, what Glenn said earlier, being aware of your body, being aware of yourself, and aware of the situation in life you're in. You might have young kids, grandkids, all these things, and you have to think about them. You have to think about them and you being healthy. I mentioned it earlier, you being strong. These are the things, and I guess it's more of on an individual basis, but that's really, to me, really what it is you personally got to understand that your health, it's not only better for you, but it's better for all the people around you, which is important, I think.
Yeah, I think just being diligent, not, you look at family history and, could it be a cause, or if there's nothing going on, I'm safe. But I think it comes up to the individual family, obviously, to make sure that you're right there and stand on top of things. I think the access, I don't know, your question was the access more or on the guy itself or person itself, but I think the access that we have is great, obviously, with the connections with the teams and with the doctors. I think they're great, but I think everybody, have some sort of route to a doctor and access to make sure that these things stayed upon and very high of importance.
Let me ask you guys, do you guys all have kids?
Yeah.
Kids. Okay. So did it ever enter your mind that going to do the physical is your responsibility to be there for your kids? Is that an argument we could tell men, maybe you don't want it, but this isn't always about you. You need to be there for your family. Would that be an argument that would work?
Oh, I absolutely. I think, like you said, we want to be there for our kids. And so when you think that way, not only are you just going to be there for your kid, but like Dan has been saying throughout this conversation today, the only way you're going to be there for your kids is that you take care of yourself. If I had to pass out flyers to everyone, because we're all at some point in some way weekend warriors, and we complain about going to the doctor, waiting in line, hour, maybe sometimes 2 hours. My suggestion to you is that it's a lot better than the alternative. So go wait in line.
Yeah, my middle one, my twins are 18, and my 26 and 23 are kind of somewhat trying to navigate things on their own. They still call and check in. But my daughter went to the dermatologist's office. She's like, Dad, I've been waiting for an hour and a half. I'm like, yeah, sometimes you just got to wait, and you go to the doctors, just be patient. And, but yeah, I think that's, something for the individual to the doctor. I mean, it's like Glenn's point is great. You're waiting, or what's the alternative? Do you not go? I think it's important to put your health at the number one, because health is wealth, or wealth is health.
So, Ed, is there anything you would have done earlier in your career with what you know now? Because listening to the three of you, you guys are very educated in healthcare. Is there anything you would have done differently earlier for your health?
While playing, or right after I stopped playing?
So, both really, but after playing, you're kind of on your own now.
Yeah.
There's no annual physical. You're you're just a civilian like everyone out here.
Yeah, if I'm being honest, while playing, it was definitely a lot easier because we almost kind of like had people on top of us with the whip, making sure that we were in line with our health. But when I retired, I found right away that, okay, I procrastinated a lot. I understood how important it was to be healthy, but because I didn't have that whip on me as much, I had to be creative. And again, when you talk about your kids, when I started having kids, I started realizing that, in order for me to be around to make sure that I'm able to see my kids, get married, my kids have their kids, and to be able to be around and, become a grandfather one day, I need to be in good health to be able to participate in, certain events. I'm a weekend warrior now. I want to get out there with my grandkids when I do have them to be able to teach them how to shoot threes and play basketball a little bit. So, it's easier for me than it was when I first retired because I like he said, your health is wealth.
Ed?
Yeah, almost echo the same as Glenn. I think you just, coming into the league, I think the mindset of going out there and playing through, like somebody couldn't bend down and tie my laces. Like, why am I going out there and try to keep up, with the play why can't I just, say, hey, listen, I'm not good to go. And I look back now and I probably paid with Dan getting 2 knees, I got 2 hips. I got one resurfaced and one total hip. But I had a labrum tear that could have been fixed prior to, doing it, but just kind of get through it, you play through it. And just being more aware of that, I think, as a player. And I think we're seeing it, and now being around the guys a lot, I think we're really seeing the players, take care of their bodies, obviously with their diet. I don't think there's beers on the bus or plane anymore like there were back in the day. You see after games, the diet has changed so much. We used to have pizza in the locker room, a slice of pizza after a game, but everything has changed for these players. I think it's at their fingertips, anything they need. But there's a few things that have changed, but not the whole landscape of it. We're obviously in a good position to handle things and have the resources to get things done.
So the players don't get the pizza, but they still have it for the staff. So I have a
usually it's you guys aren't eating it all.
Yeah. No, I mean,
I'm trying to help you guys out.
try to help. Yeah. But these guys are exactly right. It's changed a lot. So the players nowadays, all the things that they have, the science, the health history, that, we have basically everybody has their own diets. The Dolphins, the food, they have all that stuff is there for them. So it's there for them to be as healthy as they possibly can. That's different from all of us because we're not in that situation every day. So all of us have to understand what's the best way to get to that point. And whatever that is, everybody's different, right? Everybody's different. You work out a certain way. Some people eat a certain way, but we're all trying to be in a position where we can be healthy for the people we care about and the people that we love. And that includes the team too, so yeah, that's kind of my take. Cause they have a lot more, a much better ability to take care of themselves now than we did back in the day. Cause drink a beer, eat a pizza, then you're good to go. That's not good to go. You know what I'm saying?
I know exactly what you're saying. Dr. Ozambela, what piece of advice would you give? What piece of advice would you give to the athletes as they transition that could affect men's health for people out here, the weekend warriors?
Yeah, like has been said before, be proactive. So once you have some people say, well, it's very difficult to even get an appointment with a primary care doctor. But once you already have a primary care doctor, then it's easier to get a revisit appointment. And when something comes up, you have someone you can reach out to. So be proactive and establish that relationship with a doctor that's going to follow you for a long time. The second piece of advice, towards the sort of athlete's mentality, is we think a lot about rehab. Something happens and then we rehab. But I almost tell my patients, you should prehab. Actually, if you're going to have surgery, before you even get to surgery, you should already be getting your body in condition. Because even though you're going to be asleep for 3 hours during the operation, your body's running through a marathon. So the more that you do now to prepare for those situations, the better off. So be proactive, early, and that's sort of an advice I'd pass on.
Dr. Friedman, what would you say?
Yeah, I think, again, just being aware and taking the step to have awareness of your body. Again, we should be looking for reasons for people to move and exercise and making sure they can do it as safely as possible. I think we take for granted that most people can exercise, though. Some people don't have neighborhoods where it's safe. They don't have sidewalks. They don't have the ability to do it safely. So we need to work to get into neighborhoods and make these things accessible. And, we say movement is the ultimate stress test. If your body's telling you something, whether it could be cardiac, it could be orthopedic, something else, then, listen to it and get some help.
So we only have a couple minutes left. One of my goals was to try and get a commitment from you guys and from the audience to either commit to a health checkup or at the very least set up some kind of fitness routine. And it's interesting that you guys talked about all of that and hopefully convince the audience that getting your screenings for preventative health and being active, taking care of your body and being there for your family are really important, right? Did you guys have any final thoughts you'd want to say to the men and women out here that would make an impact?
Well, I mean, you asked earlier, I think, Doc, that who raise your hand if you want to be healthy? Everybody, right? I mean, so what, so where is the question here? Like, there's no question. So you have to go and get your testing and everything you need to do because there's no question. We all want to be healthy. I do. I didn't see anybody hold their hand down here. Maybe my buddy Ralph did because, I don't know, he's a little nuts. But other than him, it's pretty straightforward. I mean, I said it 3 times already. Love yourself, love your family, love your friends, stay healthy because of those reasons alone, and also for yourself. That would be my advice. Yeah.
That's perfect.
Yeah, I think in closing, thanks for having me up here today. But I think when you're done playing and you've done it for so long, there was a few years where I didn't do anything. I got into that zone. I worked out every day of my life, for 19 years playing pro. I'm going to take some time off. Well, I retired at 220 and I got on the scale at one point when I literally couldn't see my belt buckle anymore. I was 255 and, switch came on. It's like, I got to make a lifestyle change. Cause to your point, yeah, you want to walk your kids down the aisle. You want to be there for the most important things and people in your life. And now when I miss a day of working out, I feel guilty. So you get into that mindset, that routine of healthy living, try to, watch what you eat and eat as clean as you can. But you just feel good about yourself after a workout and then the doctor's appointments, the wellness checks, hopefully all kind of, look good and you just feel good about your overall health and the mindset. You got a clear mind. We all know how the mindset, how important it is, as well as health. But those are the things that I, look back on since I retired, just kind of cleaning up your act a little bit and trying to go this straight and narrow.
Glenn?
Yeah, I would just like to say that, if you like being happy, be healthier. I think with those two things, it'll equal up to a better and longer life. That would be the message that I would leave you with.
Well, gentlemen, Dan, Ed, Glenn, Dr. Ozambela, Dr. Friedman, I really appreciate your time today. I hope you guys got a sense that the passion that these men have for their families and now for their own well-being. And I hope you take some of that home and make some of those changes. And if Baptist Health can help you, we appreciate it.
Thank you.
Thank you.
Thank you guys for showing up. I really appreciate it. That's awesome. You showed up. Show that dedication to your health.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health. The warmer side of care.